I think it started the journey in more than one way, but it certainly made it easier for me to appreciate what happens. Maybe you're not surprised to hear this, a headstrong kid and one of those people that like to figure things out for himself. So at 12 and a half, I decided I want to learn how to do trick diving on the diving board, right? And my first dive was going to be a backflip. Looked like fun, right? Did you know when you do a backflip, you're supposed to dive out from the board, not straight up? Hey, I wish I'd seen that. I came down on my neck. Broke my neck in two places, and this is a long time ago, but picture the situation. I'm in the hospital, I've got a cast on, I know I broke my neck, right? Yet, doctor walks in, he goes, if you don't die and you're not paralyzed, you will be crippled for the rest of your life.
Welcome to Bed, Back, and Beyond, sharing positive stories of recovery from serious back or neck injury. Your host is CK, a fellow champion who draws on her own experience with herniated disc surgery. Join her as she talks with others who have overcome the physical and emotional trauma of a painful injury, and discover for yourself how you can find hope and encouragement in recovery.
I am super excited for today's episode of Bed, Back, and Beyond. I've been wanting to have Dr. Alan Weiser on the episode for some time now. He is the writer of New Possibilities, Unraveling the Mystery and Mastering Chronic Pain. He has years of experience as a psychologist helping people emotionally deal with chronic pain. And as we know from the forums, herniating a disc or any kind of back surgery is such an emotional roller coaster. And his book, I wish I had it in 2019, talks about learning how to not just cope, but thrive with chronic pain or any kind of injury. I really hope you enjoy this interview, and if you have a chance, please get a copy of his book. I think it'll be so helpful. Hi, Dr. Allen. Thank you so much for joining me on this episode of Bed, Back, and Beyond. Before we just dive into your injury history and then your experience, how about you tell us a little bit about yourself?
So I'm a practicing clinical psychologist. I've been doing that since 1988. I spent the first 17 years of my work mainly focusing on the chronically mentally ill, 10 of those in a state mental hospital in New York. I started my pain management practice out here around 2022. Long story as to how I got into doing that. But the work I did with the chronically mental ill is critically important to the model that we developed. So before I was a psychologist, I was a trial lawyer for a while. And that sort of fits with my overall mission in life. So I did that, and I made a change and got into doing this work. And not only ended up specializing in chronic pain, but figured out a way to approach dealing with it that's not traditional. And based on 2,200 patients in the last 20 years, I can tell you is definitely more impactful. So that's kind of the basic idea of who I am at the moment, how I kind of got to where I'm going. I've had a lot of experience. Remember starting with chronic pain patients years ago in a pain management program and going like, what do I think I can do to help people? Because these injuries are so overwhelming, not just herniations, but name it. I've been down that road. Often, as you know, multiple problems, not just one. But the story ends up being the same. And the approach to dealing with it ends up being the same, which is the good news that whether it's a herniation or something else, what we'll talk about actually can make a difference.
And you have your own personal experience with injury, correct?
Yeah, I think it started the journey in more than one way, but it certainly made it easier for me to appreciate what happens. I was, maybe you're not surprised to hear this, a headstrong kid and one of those people that like to figure things out for himself. So at 12 and a half, I decided I want to learn how to do trick diving on the diving board, right? And my first dive was going to be a backflip. Looked like fun, right? Did you know when you do a backflip, you're supposed to dive out from the board, not straight up?
Only from watching some Olympic divers hit their heads.
Hey, I wish I'd seen that. I
Yeah.
came down on my neck.
Oh my goodness.
Yeah, broke my neck in two places. And this is a long time ago, but picture the situation. I'm in the hospital, I've got a cast on, I know I broke my neck, right?
At 12 years old.
Yeah, doctor walks in, he goes, if you don't die and you're not paralyzed, you will be crippled for the rest of your life.
Oh my goodness.
I'm hearing this at 12 and a half, right?
Right. I can imagine that just kinda shapes who
Well,
you
let's
are
put it
from
this
that moment
way.
on.
It caused tremendous damage in my life for many years, starting with me almost flunking out of high school.
Why do you think that was?
Great question. Let's put it this way. That was one consequence. There's other consequences, which I know you're familiar with, dealing with the emotional impact of having these things happen. I didn't actually know why. If you asked me in high school, I would have said I'm failing because I'm not smart. I would have debated with you if you tried to insist that I was smart, right? I've got two PhDs. Presumably, I may have some intelligence. But in high school, I didn't do well because I was convinced I wasn't smart, but never actually asked myself, why did you think that? I did fine in grade school, right? 4 years ago, working with a patient and recanting his story, I remembered something I had not remembered since that day in the hospital with the doctor. I remembered what I thought when he said what he said. What I thought was stupid, stupid, stupid. Look what you've done to yourself.
And that could have such a huge impact.
Well, if you talked to me during the time I was recovering, which involved me being on my back in a brace for a year at home, not allowed to get out of bed, and then another year to be able to walk again because I was so atrophied. If you talked to me during that time, I would have been cracking jokes and acting like I'm fine. Nobody knew I was terrified. I didn't allow myself to know it. And I certainly didn't allow myself to know that I was blaming myself. Right. That followed me for years until I finally worked it out. So I understand the consequence of how you react to what happens. I understand the devastation that these events happen in a person's life. And I understand that if you don't cope with it in optimal fashion, it's going to make it a lot worse. And I'm sure you know that, and other people you work with know that. So that was kind of my fundamental understanding. I always wanted to be helpful to people. It just comes from my family dynamic, my family ethic. So I became a lawyer to represent people that usually weren't represented. I worked for Legal Aid Society in the beginning. I've always been wanting to help people that don't have a voice, that aren't being heard, right? That don't get equal representation. So it was not that different to switch from being an attorney representing those people to being a psychologist who works with chronic pain patients who are the least represented community in the medical community and the most abused and mistreated and misunderstood. And I'm not being critical of the medical profession. They have a two-dimensional model. The medical model is not holistic, and that's the problem. It's not existential, and that's a bigger problem. So that's kind of how my experience related to me understanding what it's like for my patients. Then also, they've been incredible teachers. My intake packet, here's the concept, right? And this is what you spoke to that I think is really important. Part of the reason why chronic pain tends to be so mysterious to people, where they sort of have a hard time getting it, right? Even the experience of pain, right? You and I know pain is not uniform. All right. If you're a soldier or a policeman, you're getting shot and you're still fighting. I mean, how do you do that? I can't even imagine it, right? You're the mother lifting the car up to take your baby out from the crashed car. I mean, to think that pain has to be some particular experience isn't accurate. There's a lot of things that affect how you experience pain, how much you have. So, what I began to understand because I'd worked with the chronically mentally ill and understood their psychosis wasn't the problem. The problem was the damage it created in their life. You want to help one of those patients, you treat the life, you don't treat the injury. Right? That's something that has to be taken into account and addressed, but that's not the problem. The problem is collateral damage. Right? That book that I wrote is all about all the different ways you can be harmed by this that are not just the injury itself. And then those will feed back into the problem. You know, sleep disruption, which is typical, that can increase your pain by 50%. 50. But what doctor ever told you that in your treatment? What doctor ever told you that?
None.
What doctor told you that if you don't get reactivated physically after you've been shut down for months or longer, that if you go into PT, you're likely to fail unless you reactivate first? Quick example, I had a patient I just started with, right? A woman in her 50s. She'd had 3 back surgeries. She'd been down the road quite a bit. And she just started with a new doctor. I'm a new doctor for her. And her doctor goes, "You should do PT." Now, he's saying this after years of her doing physical therapy without any success. But he goes, "You should go and do PT," right? sends her to PT. I am just meeting with her at this moment, right? She goes into PT, has an incredible flare up, major, right? I spoke to the PT and the doctor. PT goes, I guess PT can't help her. The doctor goes, I guess PT can't help her. I go, like, maybe. So I sat down with the patient. I go, okay, tell me about your physical life for the past 2 years. What are you doing day to day? It turned out that she spent 90% of her day, 90% laying on a couch. She gained 70 pounds. 2 years of profound deactivation. What were the odds she wasn't going to flare up all over the place when she goes into PT? Did the doctor or the PT actually ask for that history? The answer is no. All right. And they don't get paid for reactivation. Right. And they also don't get paid for what has to happen after rehab, which is reconditioning. So then the patient goes, well, PT doesn't help. I helped them formulate a reactivation plan they didn't have to bill for. 3 months later, she came into PT and was successful. If I hadn't intervened, she would have written this off and she would have decided she can't be treated. And that happens all the time.
Is that part of learning what pain is not harmful?
It's learning that the pain could be created by things that are other than the pure structural issues. It's not that they don't have real issues. She has real issues, but they were being contributed to by these mistakes, this misperception. You read that book and you're going to understand there's so many things going on that contribute to my pain. It becomes less of a mystery. Right? That's why the first part of the title says unraveling the mystery. That's the mystery. There's a lot more going on than you got injured and you have some herniated disc. There's a lot more going on. The longer it goes on, the more likely it is you're going to suffer collateral damage. So I don't know if that was too long an answer, short an answer.
No, I love long answers. Do you mind if we go back to, your high school year? You realized you're your own enemy with calling yourself stupid, and then at some point, you make the decision, "I'm gonna start doing martial arts." How were you
Uh,
able how were you able to get yourself from "I'm fragile" to "I can do martial arts"?
I'm smiling because sometimes I find myself amusing. Uh, Not that I'm funny. It's more like what happened was this. I go through high school thinking I'm stupid. I don't do any sports. As far as they told me, if I turn my head the wrong way, it'll fall off. Right? I'm literally thinking I am fragile. Right? It took me a long time after they took off the brace to be willing to just do that. Right? But as I said, I was headstrong as a child, and that didn't go away. And I just became increasingly angry about the idea I'd spend my whole life not being physical, not doing things that are physically dangerous or even physically challenging. I made a decision. I go like, I'm going to test this out, right? And I'm willing to take the risk. So in order to find out whether I was fragile or not, what I did in college was I signed up for judo and trampoline. I still remember that first throw. You've seen judo, you know what it looks like.
Judo's a lot of throwing and
Oh
down
yeah,
on the mat.
you're smashing people to the ground. That's the
Yeah,
technique.
yeah.
I remember flying through the air thinking to myself, "You're either dead or you're gonna find out you're okay." Right? And I was okay with that. Don't ask me why I was okay with that, how I was okay with it. I was okay. I wasn't injured. The irony is I found out probably about 10 years ago, I was seeing a chiropractor, and he did an X-ray, which was the first time my neck had been X-rayed since the accident. And he goes like, "I know what happened to you and I can see the breaks, but I have never seen what I'm looking at." And I go, "What are you talking about?" He said, "You seem to have a perfect natural fusion. That's why your neck is okay." Now, did that happen because of treatment, willpower? I have no idea. I could have been wrong. I could possibly be not talking to you, but it was my inherent will, my sort of attitude about things, which has always been my attitude. I don't take no for an answer. I take on very difficult things because it inspires me. I signed up for the hardest martial arts school I could be in because it was more challenging and more likely to help me grow than not. So that's what I did. I decided to test it. It turned out I was okay. That helped to deal with the physical consequence. Although I never, until fairly recently, have become the complete sense that I might not be totally safe. it still tended to linger, and you know this, that even when you think you're okay, you're not quite sure, right? The emotional part of it, that took many years to work out.
I herniated a disc in 2019, and that was my surgery. I'm pretty sure it was a year and a half just to emotionally recover from it, even though physically I recovered. Maybe about took me about 6 months to recover
Yeah.
physically.
Yeah.
Um, just even this little sharpest pain where the herniated disc was would, to me, felt like PTSD would be triggered. But can we talk about when people are initially injured for a moment?
Sure. Absolutely.
And maybe you can help us kind of understand what's going on with us emotionally. You know, we have this pain that just drops us to the floor, and then we're stuck on the couch for weeks or months. And of course, there's the sadness or the agony of being in pain, but then we there's this guilt or shame that seems to come into play as we're lying there. We're letting people take care of us, and your book talks about an existential crisis. I was wondering if you could go into that.
Yeah. Sooner or later in life, most people encounter something that reminds them that they're mortal, right? And even though we know that intellectually, it's a shock to the system. I had to face that at 12 and a half, but it really doesn't make any difference. It's going to be traumatic no matter when you experience it because it's an existential threat. You think you're okay, and then you find out you can really be badly hurt. I actually herniated a disc years ago in the martial arts. So I've been through that experience. Yeah, I didn't have to have surgery, but I certainly know what it felt like. Actually, it felt like that somebody had hit me in the low back with an axe. I was down. I couldn't get up for like 3 days. So think of it this way: everybody reacts in their own unique fashion to something that happens that's traumatic. And that evokes everything about who they are as a person, their own history, the way they've learned to cope. Now, if you're a person that experiences guilt based on being needed to be taken care of by other people, that may seem understandable, except if you start thinking like, what are we talking about? If that happened to somebody else, would I want them to feel guilty because I have to help them? But then you go like, why am I feeling guilty? Right? I got hurt. Right? I need help. If that evokes guilt, that would tap into who you are, how you cope, the way you're conceptualizing it. It is an injury, and that's all it is. It is an injury with profound consequences. That's true. But if you get caught up in judging yourself, you're already in much more trouble, right? If you're a person that's always wanted to be completely dependent on yourself and nobody else, it's a nightmare to have this happen. If you're a person who's completely comfortable with that, it's less traumatic. So a lot of the emotional trauma depends on who you are and what you bring to deal with that experience. It's like COVID, right? How many different ways have you seen people coping with COVID? Some people, right? Other people. So the answer to your question is you don't necessarily have to have those feelings. But in order to not have that experience, you have to have a better understanding of why you're coping with it the way you are. And no judgment. Everybody's different. Everybody's got a story, right? And there's stuff that happens people don't pay attention to. When you have chronic pain, it tends to evoke anything about your childhood that's a problem. If you were a kid growing up in an environment where you expect to take care of yourself and don't not supposed to need help, well, that's a problem, right? If you were disappointed with your caretakers and you're dealing with typical doctors, good luck. They're not likely to meet your dependency needs in the way you want them to. So my point to you is that you don't necessarily have to experience what you experienced, but you certainly can, and it would be understandable. The key though is looking at who are you and why that reaction as opposed to maybe something different. Because it's hard enough to deal with the physical consequences of a herniation. The emotional consequences can be equally, if not more devastating. So I don't know if that answers your question.
No, definitely does. It in your book, you talk about your self-image or where you find your self-worth. And I have a husband who has a very stressful job, and I enjoy taking care of him and making his life easier so that his job is less stressful. And I also have a job where if I call out sick, my boss, who's a doctor, has to cancel patients for the day because he can't see patients without me. So then I'm stuck on the couch, and my boss had to cancel patients for weeks, and my poor husband, he got the chance, I can say now, he got the chance to take care of me, but and in that moment, that guilt, now from reading your book, was because my self-image of being the caretaker was now destroyed.
Yeah, keep in mind that guilt means you committed a crime, but what's your crime? Think about it. What's the crime that you need help because you had an injury? I mean, how's that a crime?
I often think of the old, Bob Newhart clip. Do you remember Bob Newhart? He played a psychiatrist, and, somebody came to him because she was scared of, she had claustrophobia, and his advice to her was, "Stop it. Just stop
Yeah,
it."
yeah, I know. I've seen that sequence.
Yeah, it's not
Yeah,
very helpful.
no. No, it isn't because this needs to be understood existentially. So the good news is that there's no one way to react to what happens. And there's no wrong way, but some of them are more helpful than others. Some of them come with more side effects than others do. No bad coping system, but a lot of coping systems have non-user friendly features. So, for example, if you feel guilty because you're being helped, that's not friendly. It's not helpful, right? And maybe it may be understandable, but not helpful. So that's why this book, what I'm more interested in putting the emphasis on right now is not so much what happens to people, it's about what do you bring to deal with it, right? Because you and I both know there's any number of things that can happen in your life, and I no longer have the illusion I'm prepared for anything that could happen. I understand you get to it, you find out, right? You think you can handle being married, you think you can handle having kids, you think you can handle other things going down in your life. But when you get there, not necessarily. So the good news is we're designed to evolve, right? We're designed to adapt, but you have to own what's happening first.
What do you mean by that? Own what's happening?
You look at that book and you realize that you could have up to 200 collateral damages from chronic pain that are affecting your pain and your recovery, but that a lot of that is not something you were even aware was a problem. You will address it differently than you do when you go like, why am I still suffering? Why can't I handle with the emotional impact? Why am I not more physically recovered? You don't get what's really happening here. You don't get that you're up against a much more powerful opponent than you realize.
Often with the herniated disc recovery, the doctor does the surgery, especially if they've had surgery, but, the doctor does the surgery, the neurosurgeon or the orthopedic. They tell you no bending, lifting, or twisting for 6 weeks. Some say PT, some don't say PT, but that's it. Then they're done with you. And then we're left to recover on our own. And your book starts talking about how we do physical deconditioning, and we become like our own worst enemies in that way because not talking about failed surgeries, but we allow ourselves to become so weak, like subconsciously, we're not using muscles.
Everybody's different, right? Each case has its own unique features. I don't second guess doctors, but my experience, and this is working with the best doctors in the state of Seattle, Washington, surgeons are not the best people to manage rehab. They're just not. All right. They're surgeons. They don't know rehab. They may think they do, but I've never met a surgeon that really understands rehab the way they need to. In most cases, rehabilitation PT is started within the first month, if not 6 weeks of having the surgery. It depends. I mean, I don't know your actual condition or what was done. Do you have a microdiscectomy
I did. Mhm. Yeah.
or a laminectomy?
I had both.
Yeah, those surgeries, theoretically, you can recover from within several months. Did they tell you that it would take longer to recover from that?
No, they had told me, 6 to 8 weeks is what they had told me. But, before we started the podcast, I had said to you, "Where were you in 2019 when I needed you?" When was reading your book about, how we will start guarding our bodies and not moving, I did that exact thing. So, because I was just lived in this fear of re-injury, subconsciously, I was not moving my body even months after. And someone looked at me and said, "Are you still in pain?" I said, "No, why?" It's because you don't twist your back if I wanted to turn, I would just turn my whole body. And you talk about doing a self assessment of how are you moving your body.
Yeah, a lot of this has to do with knowing that you need to dig deeper into just how vulnerable you really are. For example, do you know what everybody's hidden fear is when they have a herniation that nobody ever talks about or maybe even pays attention to?
N- Reherniating is all I thought about.
Paralysis.
Oh, mm,
An injury to the spine is different psychologically than injuries to other areas. You break your arm, not nearly the same challenge. You do something to your back, you go like, "Wow, that's where the spinal cord is," right? Not only that, but they did MRIs, right?
yes.
And you're how old, if you don't mind me asking that question?
I'm 46 now. I was 40 at the time, 41.
Okay. Did they show evidence of degenerative disc disease?
No. Mm-mm.
Okay. So did they tell you that if they're not seeing that, this is an isolated incident?
You know, they didn't go into it for me.
They
They
didn't bother to tell you that it's unlikely you're gonna have to worry about another herniation in the near future because you don't have bulging discs, you don't have other evidence of disintegrating discs?
no.
Did anybody tell you that you needed to ask those questions?
No.
I actually have a list of questions that patients need to ask that they never ask, like that. Just imagine they said to you what I'm saying, and I'm not offering you a medical opinion. I don't know enough, but I can tell you how I might see it. If you don't see evidence of other disintegration with your spine, you got a localized herniated disc, and did they figure out what caused the herniation?
No. It seems to have been there a long time because it had glued itself to my spinal cord or the door anyway.
Well,
So I,
something triggered it. Was
yeah.
it some random physical activity? Was it some
Oh,
overexertion? You have any
sorry.
idea what?
I got pulled backwards on a walk with my dogs.
Okay, so if you're vulnerable to that and then something happens, that's how it goes down.
Right.
I had it happen to me in the martial arts because I had changed schools for the first time in years. And the school that I was in had incredibly low stances, or especially a front stance. I don't know if you know what that is, but you get really low to the floor. You have the back leg extended out. And I knew it wasn't really a great idea, but I was a good student. So if that's the sensei, I'll follow the instructions, but it was too much. And that did it. But just like yourself, there was nothing in evidence in my back that said you're likely to have it happen again. So what if I told you that as your doctor? I said, look, you don't have any degenerative disc disease. That's great. Even better because most people in their 30s start to show evidence of it. You had an isolated incident where there was a vulnerability and you triggered it, right? But there's no evidence of anything pending in your back right now besides that one. That was it. We don't see other discs that are at risk. They didn't bother to tell you that. Did they know that you were frightened?
No. Or maybe.
Why don't you tell the doctor that despite their reassurances that you're frightened, that you need more information to feel safe, that you're limiting your own physical activity because you're afraid to move? Yeah, why do you think you didn't tell them? I'm not trying to put you on the spot, but
No. My husband laughs at me. I always say I live in such a way that I avoid being yelled at. I don't like being yelled at. I don't like conflict, and I'm very bad at. I used to be very bad at just being emotionally. What's the word I'm looking for? Just
vulnerable.
open, vulnerable. Thank you. Emotionally vulnerable with people.
Did you notice that there are 2 chapters in the book about the treatment experience?
Yes.
Did you notice that one of the things you're talking about is something that we talk about in that chapter?
Yes.
Just picture this, you were the doctor, right? You don't wanna make them angry. There's a lot of reasons why people don't wanna do that. It's hard enough to find a good doctor. You don't wanna alienate the doctor, right? But if they say what they said and you go like, "I really appreciate everything you do to help me. I know you're giving me what you believe is your best information, but for some reason, I'm still feeling kinda anxious and scared. Would you mind if we talk about that?" What doctor do you imagine would be upset with that?
And in my brain, I have just this doctor is a surgeon and that's all he wants to do. And so I would be bothering him if I asked him for.
But think about it, if you were a surgeon, wouldn't you consider it part of your responsibility to reassure the person emotionally? Right? The best surgeons are the ones that help prepare a person for the surgery, right? And follow up with that. Managed care has done a number on this kind of treatment. But if we were talking at the time, I would have said, go back to your surgeon and say, look, appreciate everything you've done, appreciate that you're sharing with me what you think I need to know, but for some reason, I'm still feeling anxious. And for me, it's a safety issue. What can you tell me to make me feel safer? Because I don't want to inhibit my movements if I'm worried about making it happen again. Now that we're talking about it, doesn't that seem like a reasonable thing to ask?
Very reasonable.
Right? But if your coping system has you not wanting to put yourself at risk for conflict, if it has you not being sure you could handle that constructively, if you think it's gonna lose you opportunity, you're not gonna do it. This is why this approach to this work, I basically tell people, "Don't read my book and don't talk to me unless you're prepared to evolve as a person, unless you're prepared to look at the way you operate as a person and see where you wanna change it." All right? Because with all respect, you have your reasons for handling it the way you did, and it's pretty much the way all my patients handle it. But that lack of information is what contributes to the lack of safety. What if it turns out I'm right? What if it turns out that you were never at that point in time or still at risk to have another herniation? They didn't tell you that. If they told you that, what would you be thinking?
I feel like I would have had a little bit of an easier time of recovery. Like, okay, I'm not at risk. I can move.
Yeah. In the pain management program I started with, the roughest time that was an 8-hour a day, 6-week program, and mostly for injured workers in the state. The hardest part was the first 2 weeks, because during the first 2 weeks, all that guarding and protecting, all of that deactivation hits the fan. And I would warn patients, be prepared. You're gonna have pains where you've never had them before because 'cause you've been sitting like this, and then you straighten up, well, now it's hurting on that side, right? But that's guarding and protecting, that's not a new injury. Plus firing things up when they're deactivated. If they made it past the first 2 weeks, they started to see the benefit. But for you as a patient, you go through treatment and you start having flare-ups. Are you gonna keep going? And nobody's explaining why you're having a flare-up. I don't know if that happened to you in physical therapy, if anybody didn't explain flare-ups?
Physical therapy was a godsend for me, to be honest. Physical therapy is who taught me about the brain pain connection. I mentioned earlier, I had stopped moving completely. By the time I got to physical therapy, what he said was we had to retrain my brain to fire the muscles in correct order just because of weakness and things. So I feel like my physical therapy was more of a let's retrain your brain than it was about let's do some strengthening exercises.
You know about neuroplasticity, right?
Yes. Hmm.
Just imagine you go through what you went through without most of the information in that book. Your brain is going to make you more sensitive to pain because it's going like, "They don't know what's going on. We better increase sensitivity to pain." Part of the retraining with physical therapy especially, and the program that I was in, is to go like, "You may think that that pain represents vulnerability, but it doesn't." The program challenges you to test that, and once you find that out, you can start making recovery. So, yeah, the brain's involved, but I think it's potentially misleading to think of it as a brain problem, right? All the things that go wrong in chronic pain management, all the things that are in that book that aren't being attended to, are saying to your brain, they don't know what's going on. You better do this, this, and that. But just imagine if you were told in the beginning, this is an isolated problem. There's nothing in your spine to suggest it's going to happen again in the near future. All right. You can return to normal activities within a few months. Don't restrict your movement because that's going to add to the problem. Right.
I probably wouldn't have this
But nobody
podcast.
told you that.
Right. Right.
Right. So it's very tragic. I mean, I work with really good doctors. And the weird part is you'll love this one. So you notice some of the testimonials in the book, right? I mean, the medical director for the state workers' comp program that I've worked with for years, he's one of the people that recommended it. The head of rehab at University of Washington Medical Center. These guys get it. They brought me in on major presentations, right? They love the work. They love the model. And I said to them, a lot of what's here is something that needs to be part of your practice, right? So why not? What do you think the answer was?
That's not their specialty.
You're exactly right.
That's because I
And
work for dermatologists, so
you
everyone's in
get
their
it.
little pigeonhole.
I know, I know. I heard that. I go, I don't even begin to understand that, right? We're not talking about me being the specialist, right? Because they said we send them to you. You're the specialist. I go, yeah, but half of what I work with people on is in the literature. You are not attending to what's in the literature in your treatment. That's malpractice. It's not rocket science that sleep disruption causes increased pain, but doctors don't mention it. You do that 0 to 10 score on your pain rating, and they don't say to you, well, maybe you're saying it's an 8, even though I think it should be a 4 because you deactivated, your sleep's disrupted, this, and that. They don't say that. Instead, they make you think that somehow they think you're being hysterical, right? And you think they're being incompetent, right? So the disconnect is profound. The danger to patients in recovery is profound.
I've often said in my dream world, the back surgeon would have a practice that encompasses everything: the neurosurgeon, the physical therapist, and a counselor or a psychiatrist or someone just all under one roof that they can just, this is all part of your care.
That is the program I started with. That program had every specialty in-house, but the problem remained. I mean, I was only there a few years because in the beginning, remember, I was an experienced therapist. I hadn't done pain management, but I had worked with the chronically mentally ill. And very quickly I go, this is not so different. These people are not psychotic, but they have a chronic life-altering condition, right? So I started figuring out what to do about that based on what I'd done with these other patients. The clinical director goes like, you don't need to change anything. What we do is fine. I go like, no, it isn't. I said, it's superficial. It's two-dimensional. That you're not addressing it holistically. You're not looking at it existentially. There's all this other stuff going on that you're not treating and your model does not treat. He goes, no, like we're fine. I even took the entrepreneurial position with him because I'm an entrepreneur. And I said, look, you're losing money. You could be much more successful with a better model, which is why I left and I went on my own practice and go like, they don't get it, right? They don't get it. And people are suffering because of it. So you may get the right treatment, but the odds of something going wrong and things not being attended to based on what's in that book, that's fairly likely.
I have the benefit of being pain-free now. My, surgery was 2019, took me some time to recover, but now today I'm pain-free. But there are people who 2 years later, 3 years later are still in pain and will say surgery ruined my life. And to all those people, I'm going to say, like, you need to read this book because you talk about learning how to master pain so that pain is not the master of you.
That's right. That's why the emphasis in all the work we're doing now is on mastery. Understanding what's going on is important, but what's really important is what do you do with that, right? But those people that continue to have pain, we'd have to really take a hard look and go like, what's going on? We don't ignore the medical side of it. I work with doctors on that and go like, let me understand why they're still having pain. And then also look at these other existential contributors. But the goal for people is to enlighten them and then more importantly, to teach them how to cope. So if you don't mind me asking, what do you think the best way to cope with this emotionally is based on what you've done and what you know?
What I like to tell people is to, first off, to get into a community so that they have people around them who can support them and understand their pain. That it's so helpful to have people who understand it. But one of the biggest things I say is you have to look at this as a challenge you can go overcome. Because I feel like if you sit in the woe is me, why did this happen to me? Then you'll be stuck in those negative feelings versus, okay, I can beat this.
Yeah. Well, it's a good message. It's
Is it?
accurate.
Good, good.
No, it's a very positive message. It's completely appropriate. But think of it this way. It's not about overcoming, at least not in my way of thinking of things. It's about evolving, right? Millions of years of evolution, and we don't know that we have a superior coping system that we have been provided with, that we were designed to survive anything. How that happened, I don't know. Divine intervention, something else, I don't know. It doesn't really matter. Bottom line is we all know, but we don't seem to get millions of years to evolve a way of coping, and we don't think we have a superior system. We treat ourselves like we're a cheap Ford instead of a Ferrari. We're $1 million machines acting like we're $10,000 machines because we don't know our own equipment. We don't know that we have an existential immune system. It's not just your physical immune system. You have an emotional, psychological, and existential immune system, which revolves around certain fundamental principles. If you know that and you go like, maybe I can't overcome this, but maybe I could, but only if I'm open to evolving and changing and adapting and finding other ways to cope that are more impactful. If you don't have that, you keep trying to use what you knew before, it's not going to work because it wasn't designed for something that impactful. People get reactionary. They look for simple explanations. Right? They buy into things that aren't really helpful and just perpetuate the problem instead of looking for a more enlightened approach. Right? This approach that we take is enlightened, all right, and that's based on working with this many patients and seeing how powerful it is. Give you a quick example. I had one patient who's a physician who, when I met her, she had this terrible result of bad surgery, actually, in her lower back. She had this major damage to her nerves in her back that she knew because of her work she was never going to be free of. And that take the pain you had with the herniation and multiply it by 100. So I meet this person, she's in her early 50s, and she comes through the door and says, I'm going to kill myself in 6 months because I know what's coming. I go like, okay, I've heard that before. And she meant it. All right. She was one of those very dispassionate people, which was even scarier. I could see this as a person that wasn't well connected with her feelings. So she could say that and but like no reaction. We started working on this model. And 6 months later, she says, I don't think I'm going to kill myself yet. I go like, well, why is that? Your pain is there. It's getting worse. What's different? She says, I don't know if my pain's any less than it was, but I just simply don't feel the same way about it.
Oh, wow.
All right. This many years later, it turned out that the surgeons weren't saying that the surgery was botched, but she had the suspicion it was. And it turned out that what had caused the problem was they'd left glue in there. And the glue was causing all the problems with the nerves. She had another surgery and resolved the problem. If she hadn't met me, I don't mean to exaggerate here, but she would have been dead. Why? Because she didn't have enough information. Because once she decided not to kill herself, we did a very serious investigation of what had gone on medically, and we figured it out. She hadn't figured it out. Right? I don't know a lot about medicine. I'm not a physician, but I know a lot about what happens with pain and how it manifests and how often there's a lack of information about what's really wrong. So that's one story out of several thousand stories I could tell you about how this approach doesn't guarantee you'll have less pain, although it often does, but it definitely guarantees that you become the master, that you don't have your life run by the pain, that you don't buy into decision making. That's because you don't have enough information. If you had known what's in that book, you would have treated your recovery differently, right? You could have spent a lot less time in your life worrying about something god awful happening.
And people can change their coping mechanisms?
Let's put it this way, you're designed to evolve if you need to, right? So if you want a shorthand version of the approach, it might be useful for people to kind of hear like, so what do you do? That's a bold claim that you could change the way you cope and experience more mastery. All human experience, if you think about it, right, is ultimately defined in thoughts and feelings, right? No matter what happens, eventually we translate that into this is what I'm thinking, and this is what I'm feeling about it, right? So what that tells you is how important thoughts and feelings are in human experience. Now, interesting question. What determines thoughts and feelings?
I would say, maybe what you believe about yourself?
Part of it, but
Part
as
of
a
it?
global concept, perception,
Perception.
right? And a lot of
What you
things go
believe
into
about yourself will determine your perception.
well, a lot of things contribute to perception, right? So, for example, if I'm at the scene of a terrible car accident, I'm probably throwing up. I don't do well with that stuff. But if I was an EMT, I'd probably be picking up body parts and having lunch at the same time, right? So my perception's different, right? Because perception is determined by awareness. You change your awareness, you change your perception, you change your perception, you change thoughts and feelings, you change those, and you have different actions and reactions. So that's a basic idea behind this. And that said to me a long time ago, thoughts and feelings are really important. And then I figured out these are tools, right? These are not just experiences or cognitive whatevers. These are tools. The most important, which is feelings. Most people do not know that feelings have a functional purpose. They're tools. Like, for example, do you know what anxiety is for?
Well, I do now because I read your book.
What do you think
Why
you would
don't
have
you
said
explain it?
before? Yeah, what do you
What's that?
think you would have said before? Most people think anxiety is pathological. It's a bad thing. You shouldn't have it, right? Second most important human emotion is your warning system. It alerts you to a threat to your needs. And anger, do you remember what that's about?
That your needs aren't being met?
Anger is focus and energy to deal with the threat. Right? That's why they're the two most important human emotions. Yeah, I realized that time's passing. This work can take a lot of time to explain and break down, but the point is, the reason why I know about anxiety and anger and formulated this approach to working on those is because I observed with my patients that they have a lot more anxiety and anger than the average emotional patient. Understandably, right? And I'm going like, in the beginning, I'm like everybody else. I'm going like, well, that's too bad. That's a lot of suffering, right? But I remember that life is about duality, that everything has two sides. And I go like, what could possibly be the benefit of these unpleasant emotions? And that eventually I figured that out and then tested it out. And when you become masterful about dealing with those emotions, it is the most important thing you can do to manage this. Right? Because how often did anything about your condition make you feel anxious or angry at an uncomfortable level? You know, if your approach to dealing with that was to be stoic, right? Or stuff it, good luck with that. Right? That's a finite resource. So the point is that existential immune system comes with tools. They are identified in the book. There is a second book in the works that goes much more deeply into those things. But understand that you can become the master of your chronic pain if you become master of what you really are. You are a lean, mean evolutionary machine. The key to it, I have yet to do the third book, which would be me interviewing people that overcome the impossible. I believe that the key to completely mastering this is self love. If you love yourself 100%, you have 100% of your ability to cope behind you. But a lot of people do not. A lot of people don't even know that they don't love themselves fully until they experience this, right? That's why a lot of this work eventually leads to dealing with that. And once that person becomes self loving, they become more motivated, they have more power to deal with it. You may not overcome it, but I can tell you that most of the people I've worked with benefit often to a large extent, not just even minor. But even looking at this information, how much more do you know that you didn't know before? And a lot of that you can see is helpful.
And the book is called
Uh, the book is called New Possibilities:
Unraveling
Unraveling
the Mysteries of Chronic Pain, correct?
and Mastering Chronic Pain.
Mastering, yes. Dr.
So
Allen,
it's the mystery and the mastery, they go together.
yes. Absolutely. I love the book. I wish I had it in 2019 when I when I was crawling my way out of the dark pit of despair. Um, I think it's such a helpful book, and I really hope that the word goes out for you, and for the patients, actually. I just wanna thank
Yeah,
you so
just a
much
quick
for
just a
being
quick no yeah, thank you. I just wanna give a quick note. We're redoing our website. If
Oh,
people are
right.
interested in reaching out, they should use my email address, which is aweiser@newoptionsinc.com.
Okay.
And
I'll
that
put
way I
that
can
up
keep
on the
them
screen.
posted. Yeah, just one last note because you mentioned community.
Mhm.
We have developed classes about this approach, the way learning how to cope differently and deal with it.
Mhm.
Our intention is creating an online community that, like AA, has a technology. The problem with support groups in chronic pain mostly is they are commiserating, which is great, but they
Yes.
don't have a technology, a shared technology that they can use to help them.
Yeah.
Just imagine you had a technology based on this work that you could incorporate into conversations you have with people.
Hmm.
What do you think that would do?
Yeah. That would just be an amazing help to help people evolve, like you said.
Yeah, that's coming along with more efforts to try and publicize this because I think it's really important information. It needs to be out there.
Yeah, I agree.
Appreciate
Yeah,
it.
thank you for being on this episode of Bed Back and Beyond. And to my listeners, if you have a positive story of recovery from a serious back or neck injury, I'd love to include your voice on the show. Head over to bedbackbeyond.com and click share your story. Dr. Allen, once again, thank you so much. I can't wait to get this episode out there and just get your book into people's hands.
Thank you.